Welcome back to Open Line tonight. We are talking about fentanyl, a powerful opioid that is killing a lot of people, but is also being mishandled despite it actually being available in the medical community. Let's get now to the line. I think we have Ann again. Hey, Ann, thanks for calling back. What's your question?
Yes, you were talking about Narcan. My daughter was performing at Bonnaroo this past week, and I trust her with my life, but I also live in reality. And when I went and picked up Narcan for her to take with her, I was shocked that insurance covered quite a bit of it, and it was probably worth the $40 that it cost me. And the people that were in her little, there were 4 of them in her little tent that were doing comedy, and the other 3 that were with her were extremely relieved that they had their own little Narcan to have with them. And it was very accessible, and there were many stations throughout Bonnaroo, and it wasn't that I was worried what they would do. It was the thought of what they might be given without their knowledge. Mm-hmm. And I was just really shocked that any insurance would cover the cost. So I just encourage anybody that might have a neighbor, a family member, you just don't know whose life you might save. It's a nasal spray. It's very easy to inform yourself with, and it's worth every penny of it to have that peace of mind. Yeah. So check into it. For me, it was worth every penny that I spent, knowing that my daughter had her own little kit in her little fanny pack. She made fun of it. I'm sure she used it in her comedy routine the whole time she was there, but it gave this mother peace of mind.
Hey, so, and do me a favor, when you get off the phone, get in touch with our producer, Taylor. I'd like to speak with you. If you can pass your information, your phone number to him, I'd love to learn more about what you just said. So, but Dwayne, I know you agree, obviously, Narcan. Yeah. It seems like it's, you bring a mace, you bring a Narcan. It's becoming more needed. I know the state is getting more funding to provide more Narcan. Not everyone always has to pay. I guess what's the best way for people to get a hold of this?
First of all, Ann is exactly what we're trying to have out there. People like her who are concerned parents or concerned family members and friends who understand the value of it's better to be safe than to be sorry. It's better to have my loved one here as opposed to, unfortunately, having an overdose, a fatal overdose. So Ann is absolutely right. You can get Narcan at your prescription, at your pharmacy. They can supply that with you. Sometimes the cost is minimal, and there's a range of that. It could be as little as $35 and as high as $150. I think is the last thing that I heard, but sometimes insurance does cover it, things like that. So absolutely, that's a good thing to do. It would be good. We kind of look at this like like an EpiPen or something like that. My daughter has a peanut allergy. She's 12 years old, and we've had to teach her how to use the EpiPen to save her life, just in case she gets a hold of peanut butter or something like that. This is similar. Naloxone is very similar. You want to be able to save a life. Get the training to learn how to do that, and then also also you can get a kit to be able to save a life.
What do you want to say to folks who believe that because Narcan is now so available that they're just abusing the system? I know we've heard of trends of Narcan parties where someone is there with Narcan as a group of people are doing drugs. What do you want to say to them?
Yeah, I understand the concern for any of these things, but trust me, these people would probably be doing the drugs anyway. A lot of them suffer from the disease of addiction. Some of them are abusing. Whatever the situation is, I don't think that this necessarily is going to create a situation where people are just going to do this just because they have naloxone on hand. The other thing is that when you get these kits, there's only a couple of doses in there. So what do you do after that second dose?
Well,
run out?
speaking of, might as well take out the
Sure.
kits from the bag. You brought you brought this.
Absolutely.
I think it's important to point out too that there are standing orders at a lot of chain pharmacies all over the state, so you don't have to go to your personal doctor in order to get a prescription.
Right.
The pharmacy can fill it for you without having to go to the doctor.
Perfect.
That's right. Yeah.
And like you said, 2 doses in one kit, in one box?
Yeah, basically what you have is a couple of doses. I'll just open this one. And this is what it looks like. It's just a nasal spray. Now, like I said before, our state regulations require us to train people how to use these, not to just give them out. So there's a training that's approved by the Department of Health that we follow that particular type of training. But there are 2 doses, and the reason why there are 2 doses is not because you've got twice the fun. It's not because you can save 2 lives necessarily. It's because this dose right here may only work for anywhere from 15 to 90 minutes. You may also have to administer 2 doses just in case the first one does not work. But the other thing that you want to do, and I want to make sure that I'm very clear on this, is you definitely need to call 911 when you have a situation like this. This is still an emergency situation, and so you want to call 911. Some people, after even getting the training, they may get a little nervous and they may forget some of the steps that we've trained them on. So that's why you want to call 911. They will actually walk you through how to use this as well on the call. I've had testimony that in an overdose they called 911. They told them exactly what to do. They told them how to do. So they just basically reinforce the training that we give them.
So 911 dispatchers are
Yes.
trained as of when?
Well, I'm not saying that they're trained. Well, they know the protocol. They know the protocol to do. So they'll tell you some basic information in terms of what to do. Now, what we want to have happen here is we want the emergency response to come. They also have Narcan. They also have naloxone on the trucks. Even the fire trucks do. As I said before, we try to supply as many as we possibly can. So they also will go through their procedures. Their procedure is a little bit different because they have the Narcan that we give them, but they also have the naloxone, and they are more advanced trained.
I'm curious, are they equipped in schools as well? And is this something you're looking into, I don't know, with the city to add more to the schools? Where do you stand?
Currently, we have not supplied the schools that it is available. Actually, ADAP, the company that produces Narcan, the brand name, they will allow or have an allotment of 1 kit per school. So if they're interested in it, then they can apply for that. It's a very simple process to do that. But that is something that is available to schools.
Is that something the public health department encourages?
Well, I mean, I think it's from the Surgeon General down. The message for public health is getting Narcan naloxone into the community as much as we possibly can. And again, just to that point, that sometimes the first responder is you. It's the family member.
Right.
It's not necessarily the firefighters or the police.
Right.
And so you can be that first responder technically.
Perfect. Let's get now to the lines. I believe we have Brad. Brad, if that's you, what is your question?
Yes, I got you, talked to you a little bit later. You may have covered this, but do you have to have a prescription or whatever to buy this fentanyl? I mean, not fentanyl, but the Narcan?
Technically, you have to have a prescription, but there is a standing order that has come through the Department of Health, our Tennessee Department of Health, and they've given that order to all of the major chain pharmacies around town. So CVS, Kroger, Walgreens, all have a standing order. So you don't have to go to your doctor to get the prescription. The prescription is already on file at the pharmacy. You just go and ask for that prescription, and it will be filled. Your insurance may be billed. You can choose to pay for it on your own, but it is available at most major pharmacies.
That's good. What's the general price?
I've heard anywhere from $40 to $75 per 2-dose pack.
So 1 box.
Yes.
All right. Hey, Larry, thanks for calling. What's your question? Hey, Larry, good evening. You're there?
Yeah, yes, I'm still here.
Go ahead. What's your question?
Okay, Trevor.
Yes.
Trevor, my name is Larry, and you spoke about something there that I'm very, very interested in. I hope you could elaborate on it. Patients that are on opioids, and opioids is the only thing that helps them for their pain. You mentioned that they are probably going to be exempt from all of this. When I say exempt, I'm saying, you know what I'm trying to say. Is that law? Or how is, can you elaborate out on that? I am a pain patient that any neurologist can look at my x-rays and say, you know, this boy needs help.
Yeah.
But I don't know, and what it is basically the pain clinic that I'm dealing with, which is a government agency. It's in the process of taking me off of my fentanyl and going to take me off the oxycodone like that, and I don't know any way to turn other than I've heard the expression that these patients that really need the medication are still going to be able to get it. Is that law, or is that a pretty much written thing between doctors, or what is that?
Mary Linda might know the details of this more than I do, but my understanding is that there is space within the legislation for you to have a conversation with your doctor. Mary Linda, did you happen to know the details of that by any chance?
Yeah, there are noted exceptions like palliative care, if you're in hospice care, if you're in cancer care, certain named conditions that are exceptions just based on the diagnosis. Yeah. There are other exceptions based on your pain tolerance and you know, an assessment by a doctor of whether or not the medication it continues to be needed. That is something that a doctor can apply for an exception, basically, and some if you're on TennCare, for example, those exceptions have to be managed through the TennCare process or perhaps through your managed care plan and the state. But there are ways that you can actually do that. I think one of the things that this gentleman may be experiencing is that they want to titrate a dose down in order to see what other things they can introduce that might help manage the pain so that he's not on as high a dose, and they can figure out whether or not other pain management techniques will help. If they don't help, they have the option of being able to apply for the exception. But without trying something else, there isn't basically a justification for applying for the exception.
And something last year, obviously the number of prescription, the goal was to cut down 3 days, 5 days, 10 days, depending on someone's situation. But there were exemptions.
Yes.
But it does seem like they're hoping to pull back.
And they certainly want people on as the least dose possible, because if the more desensitized you get to a higher dose, the more likely you are to overdose and unintentionally. So the idea is to be on the least possible regimen of medication and use alternative methods for pain management whenever possible. Yes.
So, you know, we talk about fentanyl. Is there something even stronger than fentanyl that's out there in the market that's being abused, that you fear will be abused?
Well, we were talking about that before during a break, I guess. But there is a new medication that has just been approved by the FDA called Disuvia, DSUVIA. It was originally introduced for battle and military usage. It has just been introduced for stateside use in public hospitals for the most part. With what happened to fentanyl, the fact that the ability to manufacture it and understanding the how the
chemical structure.
Thank you, of that. It was able to be replicated overseas and then shipped into the States. And so, yes, we've had some discussions of the fear of that happening for Disuvia as well. And the big fear with Disuvia is that, fentanyl kills very rapidly and readily because it's so much stronger than a typical prescribed opioid. But Disuvia is actually 1,000 times stronger than fentanyl. So if it were to hit the streets, it would certainly be lethal.
And is this something that you guys are still currently talking about?
We've had some very preliminary conversations with law enforcement and some other entities trying to figure out, how we could monitor this, how we could keep a handle on it. Certainly within the TATUS membership, we've had a discussion of whether or not we wanted to introduce legislation that might help with some, education or some other efforts. But it's a little bit early in the process to be able to figure out what the interventions need to be. I think being mindful of it, being wary of its potential is something that, again, we know what happened with fentanyl, and I think we can be a little bit more proactive this time with Dysuvia. So that would be our hope with any policy or legislation.
It's just evolving. Now, I know we do have some callers still waiting on the line, but please hold. We'll get to your calls in just a moment. We'll have much more of Open Line after the break.